Welcome everyone to Mom's Heart Talk Show. Once again, we are on your screens to bring you an amazing and insightful show ever to talk about our mothers, the children, the journey of pregnancy and motherhood. We've done a lot on our journey of pregnancy from the onset of pregnancy through the trimesters, and then we've come to one crucial part of it which we need to really understand what is it and then dive more into it. We Most of the time when you are pregnant, the expectation is for us to have a baby. That is the happiness, that is the insightful time of the mother to see a baby. Then for the baby to come, there is this journey of labor. Now, labor comes with signs and symptoms. Does every mother know? Does every woman know about these labor signs? Today, we have a guest with us who is going to take us through the labor signs. So our topic for today is signs of what? Labor. And then we'll go through one by one after the other, what labor is, what are signs and symptoms. If I have it or I see it, what should I do and how should I go about it? My name is Sheila Jokum, as always, your host for Mom's Heart Talk Show. You also follow us on our social media handles on YouTube, TikTok, Facebook, and others on Mom's Heart Talk Show. Our website, momsheartfoundation.org. Follow us there for our mother care products. Also on our website, we displayed it on the website. You can buy from us, order, and then we will also deliver it at your doorsteps. The proceeds from this website, the mother care products, we use it to encourage, we use it to support these vulnerable mothers, children who are in need, these SSOS homes. That is what Mom's Heart Foundation supports. So we are not enriching ourselves with the proceeds that comes, but rather we are giving it back to society. So as we give education, we also support mothers out there. Guest for today, who is in the person of Madam Tracy Asare. He is a midwife at the Kolebu Teaching Hospital. Madam, please, you are welcome.
Thank you.
So our topic for today, labor signs. Our viewers who journey with us know that we've gone through from the scratch, how to even prepare, you plan for pregnancy and everything, the trimesters, the danger signs and everything that you need to know. Now we've gotten to the end of the third trimester, where we are expecting that labor will start when they are in the 9th month or the late part of the 8th month, where labor will start. When we say labor in pregnancy, what is it?
It is practically the process of giving birth. But when it comes to the clinical aspect, that's where we have the epidemic contractions. That's where the cervix has to also dilate to help in the expulsion of the fetus and the other contents of conception, which is the placenta, the umbilical cord, and other membranes that aided in sustaining pregnancy.
What stage of the pregnancy that I should expect, or this labor sign should begin?
Okay. So pregnancy is supposed to go to term for 40 weeks.
Okay.
But we always expect about 2 weeks before 40 weeks or 2 weeks after. So that's why someone will say, hey, maybe after 10 months, no, this is 42 weeks. It's normal because we expect it 2 weeks before and 2 weeks after. So when you have 40 weeks and labor are still not certain, just be rest assured that labor was certain because we give you a maximum of another 2 weeks after the full term.
Okay. But what is the ideal full term?
Full term is 40 weeks.
40 weeks, that's the 9 months?
Yeah, the 10th month.
10th month.
Yes.
So it's not the 9 months we know?
No, it's 40 weeks.
40 weeks?
Yes.
Okay. So if, at what time, is it from 8 months or like 36 weeks that I should start expecting it? Or I should reach, because I know most people don't reach the 40 weeks.
Yes.
So at what time should I now expect that maybe from 36 weeks going, or I should start expecting labor signs?
So we don't normally give 36, we give 37.
Okay.
So from 37 going, you have to expect labor. You have to be prepared for labor.
For labor.
From 37 weeks.
Okay. Let's come to the signs. So now we know what labor in pregnancy is, not the labor commission. It's labor in pregnancy. And then we know that from 37 weeks, we should expect. What are the signs?
So the signs are a lot.
Okay.
But the normal one that people will say they feel is the contractions. And that's when there's hardening here. That's on your fundus. You feel a hardening, and it's compiled with the lower abdominal pain, the pain here. So you feel a pressure on your pelvis and your back. So it aligns with it. Yes, and we have the blood issue. You see some mucus with a small blood inside. Also, we have the water breaking. I'll say in suegumi. Okay. That one too is part. Some people too, during labor, they have nausea and vomiting.
Okay.
Yes, everybody and their signs. And some people too feel restlessness. They are restless. They can't, like, everything that is going on around them eases, like, it eggs them.
Okay.
And some people also have the urge to nest. When labor sets in, that's when they will start preparing. I'm doing this, I'm packing. The feeling of nesting also shows that labor is setting in, because it's something that is psychological. It's telling you that prepare this.
Okay.
So it's preparing you for labor.
Okay. You spoke about the contraction.
Okay.
How is it like? Because like that's the most signs we see, but is it different from individual, the contraction, or is the same thing that happens to every pregnant woman?
For contractions, it's the same thing, but it pertains to the stage of labor that you are in, that you see the number of minutes it lasts. So when you are in the latent phase, the starting of labor, we can give you a duration of 5 to 30 minutes. Okay. It can last that long. Okay. And with that one, it can last for so within that 5 to 30 minutes, you can get 3 contractions, which is lasting, the highest can be 25 seconds, 30 seconds. Okay. But when you get into the active phase of labor, where the cervix has dilated to 6 centimeters, that's when it's short. Within 2 to 3 minutes, you are getting high contractions, which last over 60 seconds. Okay. Yes, so the contractions...
So you mentioned dilation of the cervix.
Okay.
So does it mean that the contraction, that kind of pain that we have in our pelvis is dilating the cervix?
Yes.
Oh, okay.
It dilates the cervix, as in when the contraction is simply when the uterus tightens and relaxes. So if it tightens and relaxes, it's putting pressure on the fetal buttocks, which when the head is down, so it's telling the head to press down. So when the head presses down, the cervix will thin and efface. So it will open, then it will dilate. Yes. If there is no contractions, labor will not come.
The cervix will not dilate.
Yes.
At all.
Yes, because the uterus must tighten and relax to expel baby.
Oh, okay. So can someone have other signs without contraction and still the baby cannot come out?
Some contract, but it pertains to some people's pain tolerance. Someone will be walking about doing everything and be contracting, but that pain is mild to her. So she doesn't feel it as contraction. But other people too, their pain tolerance is so high that even the mildest contractions that they are feeling, it will make you see that, oh, she's in labor. But some people can walk about contracting it, and you think that there's nothing happening to them, but their pain tolerance, yes, okay. But their pain tolerance is high. So they don't, so they don't display that they are in pain or anything, but they are contracting. Yes, so it pertains to your pain level and your tolerance.
Still on the contractions, as you said, the latent phase, where you don't normally see it often. How do you want the counts before someone should go to the hospital?
So we time it in 10 minutes.
Okay.
So in 10 minutes, let's say within the first 2 minutes, you got 1 contraction. One contraction lasted more than 30 seconds. Then within that another minute, you got another contraction.
Okay.
We lasted above 20 something seconds. You see, so within the 10 minutes, the number of contractions you get plus the seconds that it lasts will show you that, oh, this one is contraction. I have to go because it's rhythmic. It doesn't stop. It's continuing.
So the contraction, how many hours does it last for the cervix to be completely opened?
So labor pertains to everybody. Someone can be in labor for 24 hours.
Okay.
Yes.
That's the whole day.
Yes, the whole day, especially for the primates, the new mothers. Yes, but those that have delivered before, we can give them 12 hours. Some also go as low as 10 hours. 10 hours, 9 hours. But that's what we normally call precipitate labor. Yes, but for those who have delivered before, we give them like 12 hours.
12 hours.
Those who have not delivered, 24 hours. So you can be in labor for 24 hours and you still get it.
But some who have delivered before, so now I know the difference now. So those who go along, but some go more than 24 hours?
Yes, so sometimes, let's say you are in the house, you see the mucus plug. The mucus plug coming, that's the bloody shoe, doesn't mean that you are dilating. So you can see the bloody shoe 3 days before labor will set in.
Before the contractions start?
Yes. So sometimes someone will say, oh, I saw this one that 3 days ago, and I was having this small pain. But this small pain, the contractions, was it continuous?
Okay.
And was it aiding in the dilatation of the cervix? And when you go to the hospital and we check and the cervix has no opening, because it's the opening of the cervix that will make us know that baby is calm. So someone can have a show 3 days ago and think that, and count those days as being part of the labor duration. But we count labor duration normally when we see that the cervix is opening. Yes.
Okay. Can someone have contractions for days?
Yes.
It comes, then it goes off, then it comes maybe a day after. Is it possible?
Yes. When you get to your ending part of pregnancy, you can start having this false contractions.
Oh, okay.
It just comes, then it goes. It comes, then it goes. So you think that you are in labor. Today you have this pain. Then you say, oh, I'm ready for labor. But the next day you'll be so energetic, you do everything. It's like you are not the one that you were feeling the pain yesterday. So that's false contraction. But it's telling you that labor is about to start.
So it's another sign that it's to start soon.
Yes, but just that it's a false alarm. It's a false labor.
Okay.
Yes.
So but the actual one continues.
Yes.
Oh.
It doesn't stop.
Oh.
And it lasts within 10 seconds. You have to 10 minutes, you have to get like 3 contractions or 2 contractions, which are strong.
It comes with pain.
Yes.
Do I need to take any medication to reduce the pain?
No. So with the pain aspect, I think you have to come to the hospital for us to give you the pain medication. That's when labor has prolonged. Usually someone will be in labor for like 12 hours and she's contracting, the pain is there and everything, but just that she can't the pain. That's when we are trying to see that. So because normally before we give you epidural, I have to let you go to 4cm first because yes. So you have to, before you give analgesia, you have to see that if the cervix is dilating. Sometimes giving analgesia will slow down the process of labor. Because patients will lie down.
So does it mean that the person will not contract because of the painkillers?
Sometimes you'll be contracting, but later you won't feel it.
You won't feel the pain.
Yes. But we normally don't give analgesic painkillers when you are in labor. Oh, we are not wicked.
Are you excited when we are going?
No, we are. There's some people like unmedicated bed, but there's a time that we see that this pain is too much. We'll give you a painkiller. Oh, we are not wicked.
They should experience pain.
Oh, the pain makes you know that baby is coming.
If you can give analgesics, then why should I go through the pain?
So maybe you just started labor 1 hour pain, or you say you want pain.
Pain is pain, oh.
Hey.
How many hours should the person?
Oh, but it's
because that's
everybody's pain threshold. So I think we the midwives and the doctors will assess you. And if the need arises fast, we will give you. You are
when
main,
it's beyond the threshold.
yes, you are main priority. Our main aim is for you and the baby to come and everything to be okay with you and the baby.
Only hear that.
Oh, we do
Our
have
viewers, you are not agreeing with. We don't normally hear that. So when I got to the hospital, the midwife gave me painkillers, so I didn't experience anything. That's why now people are opting for CS.
Yes.
Because of the pain.
Yes.
Though there are other
So
reasons why someone would opt for.
So I think
Yes.
people are not very well abreast about the fact that you can also opt for epidural
Okay.
if you have the resources. You can opt for epidural during labor. Yes, but some people normally like the unmedicated birth. Yes, no medication, just
And
that
they will know that yes, my brain and my home.
God is so wonderful that the moment baby comes out, although we'll be doing our other things there, but the moment we place baby on your chest and you feel the touch of baby, you forget about that pain. But you won't totally forget about it, but you have a sense of assurance that all this that I went through, see what I got.
Okay.
Yes.
Okay. So we should go through. You understand? We are going through. All right. So from the contraction, how is that pain like? People normally assimilate it with the menstrual pain. Is it like that?
Yes.
Oh, okay.
It's like that, but when it gets to the active phase, it's more times 2. Yes. It's times 2 because you see, when you're having menstrual cramps, you just feel it here and a little pain at your back. But with that one, you're contracting here, there's pain here, then your tummy too is hardening. So it's like 3 pains combined together. You don't know what to do. That's why.
Is it the bones that are separating or what?
No, it's the muscles, the uterine muscles that they do the work.
So it's not the bones.
No.
Because somebody said that when the contraction it means that your pelvic bones they are giving way, they are pushing back.
No.
That's
So the
what
uterine
really
muscles just tightens and relax, and as it's tightening, it's pressing on the fetal buttocks to go down into the pelvic rim. So the head engages to the cervix. So as it's tightening and relaxing, then it's forcing itself, then it's making the cervix gradually dilate. Because at the time that labor will already start, now baby's head has already settled in the pelvic rim. Yes. So it's no bone, it's muscles.
So viewers, you know, there is no bone separating or stretching. I don't know how it's stretched though, but that's what we heard. And we want to clarify that there is no bone that is separating itself, giving way for baby to come. It's the dilation and the contraction of the muscles, the uterine muscles, that is happening over there. Just that we don't see with our eyes, but our midwives are telling us that is what happens. Okay, so we move on to the next side, the show.
Yeah, bloody show. So the bloody show is necessarily at the cervix. They have a lot of blood vessels. Because someone will say, hey, I'm coming to deliver and I'm seeing blood. So there are a lot of the cervix is rich in a lot of blood vessels when you are pregnant. So as the cervix is dilating and there is effacement and it thins out, that's the mucus plug tears.
Okay.
Then the blood vessels also ruptures. So that's why when you see in your pants, you see some small mucus and blood. So the blood vessels rupture, then the mucus plug also covering the cervix also tears. So that's what we get.
Okay.
So it was protecting the cervix, but it has just. So when that one comes out, you know that
the fetus doesn't come out or what?
No. When you see a mucus plug, it doesn't mean the fetus is coming now.
Okay.
Just that the cervix is about to open. Because the mucus that is covering the cervix has teared, and the blood vessels around it also has ruptured.
Okay.
So it's
that's
giving
what
way
we
for
see
the yes.
as show.
Yes.
And then it's a sign that you're
Labor,
about
yeah.
to get labor. Okay. So is it everybody that sees the show?
Some will say they don't see it, and some don't see it because sometimes you'll be bathing and you just be washing there and it comes, but you don't see it.
It's not plenty.
It's not plenty.
Just the steam.
Yes,
Oh,
little.
okay.
So some you be bathing it to come, you know. Some you be urinating it to come, you know. But those that see it is when maybe you'll be wearing your underpants, then you see it inside. Some you will urinate and it will come out. They don't know, but so they'll tell you that they didn't see, but it has come already.
Oh, okay.
Yes.
Do people report to the facility when they see the show?
Yes.
Because we know that from the danger signs that we learned the other time, seeing blood, it's a danger sign.
So that danger sign is blood. But with this one, it's a mucus plus blood. So you see something slimy plus blood.
Okay.
But with danger sign, you see only blood.
Okay.
Yes.
Okay, so that's the difference.
Yes.
Okay. So when people report, what do you do to them with the show?
With a show, and if the person is terming, we are able to do cervical examination. We have to do cervical examination to see if the cervix is dilating, and also auscultate to feel the baby's heart rate and see if everything is okay, the descent is okay. And if the cervix is not dilating, mostly in the district settings, since there is no plenty blood, bed and everything, if the cervix has not dilated, we'll tell you to go home and we'll teach you about other signs.
Okay.
When you see, you should come, just report to the facility. And sometimes we even go as far as taking their bags and everything and keeping it there so that it will be easier transportation for them.
When they come with the shoe?
Yes.
Oh, that's nice.
Of the waters. So that's the sack that the baby lies in it. So the moment that water comes out, wherever you are, you have to go to the hospital. That one is not like shoe. That's waters coming out. So the sack holding the baby and protecting the baby is off. So right now there's no immunity around the baby.
Oh, okay.
Yes.
Any you swap.
Yes. So that's why sometimes before.
But most of the time they want to see that in the house before they move to the hospital.
And that's sometimes when the membranes, the waters break, it's sometimes not good and good because sometimes some will see water breaking, they won't do anything about it, then they'll be walking in the house. And when the water breaks, it's not sometimes the fetus is not lying well.
Okay.
Yes, so the position can also be bad. That's where we have this cord prolapse because there's nothing covering there. You see that the cord is rather now coming out. Yes. So sometimes that's why we say when your water breaks, come to the hospital, no matter what, because the sac and the membranes covering the baby is off. And so when you come in, you are not to 10, you are not up to 36 weeks. You have to start giving you antibiotics. Yes, to protect the baby. That's what we call preterm. They are having contractions plus membranes have ruptured before the 36 weeks. So you have to come.
Okay.
Yes, because there can be an infection there if you don't come for us to see. And when you come in, your waters have break, we know that whatever we must do and must let labor set in, we have to let labor set in.
To deliver the
Yes, but naturally, when water breaks, labor has set in because your cervix is dilating.
So can this water break whilst the person is not due?
Yes.
To the 40 weeks?
To the 37 weeks. Yes. Some people
have to deliver the
some people's water break at 35, 34. Pertaining to so when we come, normally at 34, 32, we will take a scan when the waters are break. We'll take a scan to see if we can carry you and manage you till we get you to a favorable 10 for us to deliver the baby. If the cervix is not dilating, but if the waters are break at 32, say your cervix is dilating, whatever we do, we have to deliver baby and take baby to NICU. But if cervix has not dilated and we are losing waters, we have to go and take a scan to see the amount of fluid left around the baby. Okay. So we'll be giving you antibiotics, yes, and we'll also be running fluids. Then we'll maintain you till the time we are able to deliver a baby.
So is there a way you can get fluids to the baby?
We normally run fluids.
But does it support the baby does it go into the sac?
No. The sac has already broken. So we are just managing and keeping. But sometimes, normally, the instances I've seen, water breaking, cervix has dilated.
Most of them.
Okay. So whatever we have to do, we have to deliver. Yes.
Oh, okay. But most of the time, you were saying then you have to support the person with antibiotics.
Yes.
Why? Why antibiotics?
Antibiotics
Because it's inside. So
yes,
where does the infection get to the baby?
the infection will get to them because there is no immunity. There's nothing covering the baby now. So we are giving the antibiotics as now the new immunity to cover the baby. Because although the placenta is there, but the baby being in the sac now, it protects the baby from everything around. So the sac being off, we have to give antibiotics to also now come and protect the baby in utero.
For how long?
So normally we give it to a duration of some.
So you deliver the baby or
No. We give it to a duration of some. Sometimes 25, sometimes 48 hours, pertaining to when we take the samples, the amount of
it comes maybe dropping, or it just bursts like that, all the water comes out down like that.
So some people will see the gash. Some people will also see this as leaking, small. You see when they start leaking and you put a pad, then when you put a pad, you see that within some few minutes the pad is full. So you see that you are losing waters. Your waters are breaking. It's not like many people. It's not like the movies that you see that it has gashed out. Some are becoming slowly because you'll be sitting down small time. You see that where you are sitting down is wet.
It's wet.
Yes. So.
Oh, okay. This school of thought that from our home school of thought that when the water gush out like that, it can even it passes through your mouth, and then all your teeth can go off.
That I don't know, and that we have not certified it. But
so apart from the coming through the cervix, is there a way that water can pass through?
So we have something we call amniotic fluid embolism. That's also something we are afraid of when fluids rupture in the house, and we are not even the hospital cry. It's sometimes an oversight, and it can cause problems to the mother.
Okay.
Yes, because that's when now the fluid will start to go into the veins and it's come and cause. So the mother will be having respiratory distress. Someone will say when the fluid just came, she got up now. She said she can't breathe. It's an amniotic fluid embolism. It has moved up, into the ear. So it doesn't go into the mouth. That one thing, I don't know.
Maybe that's why they are saying it comes to because once it can get to the chest, and they give you distress. Maybe that's why. Because I've been hearing this a lot.
Some say their teeth just broken.
Yes.
But
it's just a misconception.
I think unless we go and do a research on it and see how true it is.
Okay.
I can't give them the answer.
All right. But I learned that water is very hot.
I won't say it's hot. It's warm.
It's warm.
Yes.
So when it gushes out on your body,
no, it doesn't bend.
You don't have any bends.
No, then we midwives we've been bend though.
Why?
Some will be lying on the bed and it will gush out. It will be on our face. Then we've been bend though.
Oh, okay.
Because they like if that can be.
So have you tasted some?
Some has gone into my eyes before.
Oh.
Yes.
Did they cause any problem for you?
No, I just went for them to wash it.
Oh. So how warm is it?
It's not that
because the
warm.
way people are describing
it's lukewarm. It's lukewarm. It's like
really. So when it's there, you don't see any vapor coming out.
No. There is no vapor. It's no. We beg them because because the number of liquor that has poured on midwives in Ghana and all over the world, we will all be burnt victims. It's not. It's just that God is wonderful. That you see, the outside world is different from the baby's inner part. So God has created something so unique for baby to lie in that. Baby is not feeling hot. Baby is not feeling cold. You see, so baby is in a friendly environment. So when baby comes out, baby knows that where I was, I didn't feel hot, I didn't feel cold. So when I come, you have to give me that same treatment. That's why babies don't know cold and heat. Okay. When there's the weather is cold, you have to cover baby. When there's heat, you have to let baby have some freedom and feel free. Yes, but please, it's not hot, it's warm.
It's warm. Okay. So ideally, we should not wait for our waters to break in the house.
So sometimes you can't control it. You be in the house and water will break. Just pack your things, come to the hospital. The moment your water breaks, please go to your hospital. Call your midwife. Tell them I'm coming. They will be expecting you. Then you go.
Are there instances where a pregnant woman will experience water breaking?
Yes, some people's water break when they've dilated to like 8 centimeters. Yes, and there are some that I think so with that one we call it spontaneous rupture of membranes. There are some that the doctors and the midwife must assist to rupture. Yes.
What causes that? Does it mean their sac is thick or?
No. Some people will dilate to 10 cm, then sac will be protruding with baby
Trying to come out.
Yes.
Have you? Is it
so you
possible
have to rupture.
deliver?
No, you have to rupture.
You have to rupture.
Yes.
So at what stage of the contraction you need to rupture them?
When the patient is at, we don't normally like rupturing membranes because it's unique. It also aids in the dilation of the cervix. But when we see that the cervix is not dilating, we've not ruptured and the cervix is not dilating, we try to go in and do the artificial rupture it by itself. Then we try to dilate the cervix. Because when we've ruptured now, we are trying to force baby's head to now come. Because right now you are not in the sac.
Okay.
So come.
Okay.
You understand? But some people will not rupture membranes. When they get to 8 centimeters, membranes will rupture by itself. It's the contractions that makes the membranes rupture. Because if it's the uterine muscles is tightening you get to a time you have no option than to release yourself and go.
Okay. But there are cases where the mother is having the contraction all right, is rhythmic all right, the membranes has not been ruptured, and then the contraction will stop or delays. Is it the cause of the membranes not being ruptured that is causing the contractions not coming up fast?
No, if contractions was there, was the cervix dilating?
Yes, but not as fast as you want it
to dilate.
Yes.
So that one, like in my setting, we try to help you. We try to pray and push you to go to 4 centimeters. That's when we see that we can augment. We can come in and augment labor.
Okay.
Yes, but some labor varies from everybody. Someone will be having, someone will come. She's around 2 cm. Contractions will be there today. Contractions have stopped. She started at 2 cm. But when we check that fetal heart rate is okay, everything is okay, everything is within the right parameters, we don't try and force patient. We just give the baby time. Some babies have their own way of coming into the world. Your timeline is not the baby's timeline.
Okay.
So you
just
allow
them to have their own time.
Just that we always make sure that everything is within the right parameters. If it's not within the right parameters and you are not dilating, that's when we try to see if we can induce labor to see if cervix will.
So we've done the breaking of the waters, we've done the shoe, the bloody shoe, we've done the contractions. Contractions that I think it runs through.
Yes.
You mentioned nausea and vomiting.
Yes. So those who start having nausea and vomiting, they dilated. I don't know how, but they dilated.
So when you are having nausea, you don't need to dilate.
You see, when they dilate early because the uterine muscles is contracting, you are reaching, you are forcing. So when you are forcing yourself, to make the tightening more. So right, it also aids in pressure and also opening of the cervix.
Oh, okay.
A lot of women have nausea and vomiting. It also aids in the dilation of the cervix. Someone would say when I was pregnant, I started vomiting. When I was in labor too, I vomited somehow. It's normal. It's a sign of labor.
Okay. So labor is unique.
Labor is unique, but we have signs that it's pertaining to everybody.
Everyone.
Yeah, the contractions, the mucus plug, the breaking of waters, the pelvic pressure and pain, which is added with the back pain. You have to feel it. But the nausea and vomiting, it's not everybody that has nausea.
Yeah,
and
you
vomiting.
mentioned the back pain. So when the person is having that back pain, when you rub it, unless you are rubbing the baby's head,
No, you don't rub the baby's head. When you're having a back pain, we always encourage their husbands to give them a massage at the back. Yeah, it relieves the pain. The baby's head is not there. The baby is in
even when you scratch your body, if you are scratching
the baby
baby's hand, when you
is
scratch your hand, you are scratching baby's hand. When you scratch your cheeks, you are scratching baby's
When baby's head drop into the pelvic pain, it's now in a posterior position. The face is now facing the abdomen, but the head is there. So baby's head, the back of the head is that. Yes. And
so you don't, it doesn't interrupt in any labor.
No.
When you are doing the massage.
No, we just give massage. The massage helps.
Okay.
It helps to relieve the pain.
Okay.
Yes, and we try to sometimes do this warm compresses also to help them. It's painful. The back pain, you see, you are feeling pain here, you are feeling pain there. It can make you go mad. So try to let the husbands come in to give them some massage. Yeah, so the husbands, we beg you. The massage is important.
Husbands, you have a lot of work to do.
Yeah.
So, what if contractions are delayed? What can the mother do to aid in or fast track the contractions?
So we have
Because sometimes you get to the, when you get to the labor ward, there are funny drama, everything is there. You see some mothers climbing steps up and down, and they will tell you that maybe I said me con nantina the some you ask them to go and have sex so that labor would fast track. Some do press up.
Oh, press up. They don't say press up.
But there are a lot of things going on there. So it's the things that they do, does it really fast track labor?
Some do. Like this, the staircase is, we call it the curb walking. Okay. You are trying to balance your pelvic bridge, so it's going like this. So it's trying to tell your muscles that give way.
Oh, yes. So it's just a psychological information that
yes, and it sometimes aids in the opening of the pelvic bridge. And we have those who have the birthing ball, they sit on it, they try to rotate their pelvis, they sit on it and rotate. It also aids in it. And the sex too. The prostaglandin is released to go and soften the cervix. The sex there sometimes is mostly important to us. But if you don't have the energy to have sex, it's not by force to have sex.
Okay.
Yes, it's not by force to have sex. But you can do this birthing exercises. But just take your time. Yes, but just take your time.
Okay.
Do what your midwife advises you to do. Don't just do what you feel like will be better for you. Make sure your midwife has advised you that do this.
Okay.
Yes.
Okay.
But some can cause complications. Yes. So just you take your time. And labor varies. So when baby has not come and everything is okay, don't worry.
Hey, many people are worried. You can be in a world where everyone is giving birth. I remember my first baby. When I went, there were lots of people at the labor ward, like even some on the corridors, like a market day that day. And within some hours, everybody has given birth. I was left alone. So I became anxious. Why am I alone? Why? What is happening to me? And I was primary. So the thoughts that will be coming. Why am I alone? Why? What is happening? Does it mean me? Do I need CS? What is happening to me? Because there were a lot of them. So the nurses were going up and down like that, just to deliver everybody, and everybody was gone. I was just pushing one room. Madam, relax.
Hey, you relax.
And the midwife slept. Sorry, that's when we labor. So I think they realized that I'm sleeping. Who comes to the labor ward to come and sleep? I'm sleeping too much. So they did induction without even knowing that they have even put this Sinto inside the infusion. So when I started having the birth, and the person didn't, I went to also sleep because they know like my contraction was delaying. It comes and about an hour before I'll have another one, another hour, and then and they have to do manual rupture of membrane. So it's that anxiety is there. That I want the baby. You want the baby to come out early. One, the pain that you are going through, you want it to end. You want to see how your baby looks like, and you've seen other mothers carrying their babies. So that anxiety is there already. So if you tell me to, Madam, have patience, the baby will come.
When you come to the labor ward,
do we prepare mothers psychologically?
Yes,
like
so
with
we have to.
The duration of
during antenatal, we have something we call birth preparedness and complication readiness. We have to prepare the mother, especially if the mother is a partner. We tell you that when you are entering the ward, you have a lot of seniors there. Someone is gravid at 5.
Yeah.
She has delivered 4 before you. You, this is your first time. So when she comes and she goes, don't say that, Mache, Onche. She has gone through this one 4 times. And she to her first time, she was telling somebody, say, Mache. So we have to psych them and tell them that everybody is different. You that you're a primary, your labor can start 3 days. Yes. And you yes. So someone who is not a primary, the person starts feeling pain right now. She comes to the hospital, you check, she's 4 cm dilated. You see, so that person can, you argument, you do anything. You see within the next 4 hours, you do VA, she's full. That's the person. You to your own will be different. Yes, so just that we beg you, have patience.
So labor is unique with every individual.
Yeah.
So you don't compare yourself to other pregnant women. That Auntie Akosia went 2 minutes, she was back in the house. So me too, when I go, I should be back in the house. And then when you go and midwives are telling you, Madam, wait, sit here. They say they are delaying or they are not competent. Not that. Auntie midwife said that listen to them. And then do what they say, not what you feel like you do. Because it's 2 people they are in their hands that they must make sure 2 of them survive at the end of the day. So it's very critical and a very crucial moment for midwife. You mentioned true labor sign when we're talking about the contraction and force. Do we have true?
So the force will be the Braxton Hicks, where you have the contractions, but it's not like the true labor signs contraction. That one, it comes, you'll be there and you feel a little bit contraction, you say, oh, then it stops. Then you can go about and do everything you are doing. That's Braxton Hicks. So you can come, we'll time the contraction. Sometimes you will say I felt contraction, you will come, we'll get one.
So the one you let the person go home.
Yes.
Or the person
you let the person go home. We let the person go home if everything is okay. But you can't. We are checking them. The fetal heart rate is not okay. You are not going home. You are staying with us.
Okay.
Till you deliver. So that's the master.
So what's the duration between one contraction to the other?
So it's a contraction is time within 10 minutes.
Okay.
So 10 minutes. Within that 10 minutes, you can get 3. Yes. So the 3, how long it lasts, the second it lasts, is what makes us know that this is the true sign of labor. Sometimes we get one contraction is lasting 15 seconds. Okay. Within the duration of the 10 minutes, then we get one contraction lasting 15 seconds.
Oh, okay. But with the stages 1 to 10, the dilation.
Okay.
What's the duration?
The
so as you're saying 1 cm,
so
from 1 cm to 2 cm, what's the duration?
1 cm to 2 cm, we can have within the 10 minutes.
No.
Normally we do vaginal examination every 4 hours.
Okay.
So within that 4 hours, when you come to do another vaginal exam, we have to time the contraction. The contraction is timed every 30 minutes. Okay. When you check the fetal heart rate, you have to time the contractions. So within that 30 minutes, the 10 minutes that we take from it now, when we the duration within that 10 minutes, you can get 3. That's 1 to 2 cm. You can get 3. Okay. Yes, but the last thing is around 25 seconds.
Okay. So like from 1 cm to 2 cm,
you can get
25
seconds.
So like if it's continuous like that, from 2 to 3, 25 seconds.
Yes, so
Three
we
to
normally
4.
time it from 1 to 4.
1 to 4.
1 to 4 cm. We get 25 seconds, getting to 30.
Okay.
When we have a longer duration is when we get to the 6 cm, 7 cm, 8 cm. Because now the cervix has dilated. And right now, that one is not agro. That's where some people try to take
That's
off
why
their
the pain
clothes.
is very
Yes.
okay.
Yes, and that small time that is dilating, that small time, the pain there is so intense. Yes, so that one you can get 4 contractions within that 13th, and some last to 60 seconds. One contraction can last to 60 seconds.
Wow.
So if you have 10 minutes and you're having 4 contractions in it, then every contraction is lasting 60 seconds, which is 1 minute. So within that 10 minutes, 4 minutes of it, you didn't
So
have
how
rest.
do you know that this mother has reached the pain threshold? So we should come in with analgesics. Is it a shouting?
Not the shouting, but you see the way the person is behaving. The way you can, some people, it gets a time they can't.
But you know some people are very dramatic.
Some are drama. We see the drama,
Okay.
and we see those that are genuine. You see, you can see someone that maybe from 1 to 4 cm, person didn't make noise, but was contracting. We saw that the person was contracting. When you go to the 6, 7, because she's not making noise, but she can't. It's not her fault. We have to come in. She can, but some are dramatic. Some are as at 1 cm, some shouts. So sometimes you'll be saying, the midwife will tell you, hey, madam, this shouting you are shouting. When it gets to the bigger one, what will you do?
Yes.
As at 1 cm, you are
But
shouting.
when it comes to pushing, you lose.
You
all
lose the
energy.
strength. Some just shout and waste away the strength. But when you are
So we
pushing,
shouldn't shout.
we beg, no, we beg, shout. But that shouting, we beg you control it. You see, then you lose your energy. And some people, when they are in labor, they can't eat. So the food that you ate before labor started, that's what is holding you. And the fluids we are running, that's what is holding you. When you shout and you do your gymnastics,
But
and
during
chemistry,
labor, will you be allowed to eat?
We
If
can-
the person feels hungry.
when you're hungry, we can let you take in something light. Yes,
Something light.
yes.
Since this man person needs strength to go and push.
So sometimes
something
when you come in, the pain has not intensified. We can tell you they should look for something for you to eat, because the journey ahead is big. And that time when you're around 6 cm and they are bringing you back, who can you eat? The pain is there.
The
and
pain will
saying
not be
back.
allowing
Yeah.
you to eat,
So something
really.
like malt or anything, like juice, yes, to give you that energy.
We are really learning and we are happy. Our midwife, we are taking everything one at a time for you to know that if this happens, so the first one is when it comes, then you go to market, can we even go and shop, come and prepare food before one will come in the evening. That is the false labor. This is Mom's Heart Talk Show. As I'm saying, you can drop your questions and your comments, suggestions on our platforms, our social media handles, YouTube, TikTok, Facebook, and then we'll answer you. Our numbers are also rolling on our screens. You can support Mom's Heart Talk Show, Mom's Heart Foundation, as we reach to the vulnerable groups. And we have our website, Mom's Heart, www.momsheartfoundation.org, where we have our mother care products, where we sell to people and then you buy with that expectation that this is what I'm buying, and we are giving it back to society to support us. We move on to our next question, and then we want to know what should a pregnant woman do when she notices that sign.
The true sign of labor. So the first thing you have to do is to call your midwife. Yes. So
Every pregnant woman have their midwife's contact.
yeah, in the book we write the midwives.
Okay.
But if you don't have your midwife's contacts, please you have to go to your facility where you go for your antenatal care. If only they have a labor ward setting there, you have to go there.
Okay.
And if you feel that this pain, moving from your house to the hospital that you attend is so long, you can look for a good government or a good hospital near you and go and check before you can move on. Sometimes you be in labor and you feel that baby's head is here. Before you get to your facility, you have delivered in the car.
Okay.
Yes. So you have yes.
Quickly move to the nearest
hospital.
if you know that
what is
baby
happening
is
here,
coming.
baby is coming. Yes.
But if you have enough time,
You can go to your facility.
and then you should have our midwives, because now we are doing focus antenatal,
Yeah.
where you have one-on-one with your midwife. So you should have your midwife's contact.
Yes.
Midwife, do you give your contact?
Yeah, so please ask your midwife for her contact so that you call. But we beg you, don't go and call your midwife at 1 a.m. Some will call you, not asking you about anything. No. Oh, Auntie midwife, and I'm sorry, you know. I say, we be here, then meeting didi. Oh, madam.
And I don't mean it.
Come to the hospital. We are calling the midwife at 2 a.m. Ah, you see, there are some instances that the reason why we give their numbers to because of the danger sign.
Yeah.
Oh, my midwife is sorry, I'm here. Come to the hospital. We'll tell you to come to the hospital. But if you are calling me, telling me that about you couldn't eat at 2 a.m.
Midwife, me to diaper and mommy to diaper.
2 a.m. We beg you. Also consider them.
Or maybe it's an emergency.
If it's that's what I'm trying to say. We're giving you the number. You are calling for the right reason, but don't call for asking for personal.
Okay.
We beg you.
Okay. So the numbers are not for you to start conversations that are not related to pregnancy.
Yes.
So that's why people abuse these privileges that we have. Take midwife's number and call only emergency or relating to pregnancy.
We beg you. And when you're going for the ANC, we have some to bed preparedness. You have to always have to let your things be ready. So we teach you to have a transport available.
Okay.
Not that around 1 a.m. you don't have the driver who will take you to the hospital's number. You see that thing. And also now in our setting, make pregnant women's relative donate blood. It's a must for every pregnant woman's relative to donate blood, because we don't know the complications that will arise during labor that we need to transfuse or use. So you have to, before you come for delivery, you have to have donated blood. You have to have your transport person available. You have to have someone who will help you to come to the hospital. You also have to make sure your things are ready for labor. And also make money available. Pregnancy now pertains with money, because you come, you prepare, you don't know what will happen at the hospital, but always make sure that you have some financial funds available, so that when the need arises for money to be used, you'll be able to use it. Because sometimes it's sad now that people don't prepare the financial aspects and come and they get stranded. It's like
you have a whole 9 months.
9 months to prepare. It's not something big, but make sure you have funds available.
At least for a start.
Yes, when you come and you don't use it, it's a win for you. But when you come and you need it, then you don't have it. Then it makes you be at a loss. So I guess that the hospital, we always make sure we give you everything you want. Then at the end of the day, the government will.
So I think on Mom's Heart Talk Show, we spoke about planning. Don't say emergency pregnancy. We don't have nothing emergency pregnancy. Even if it's emergency pregnancy, you still have 9 months ahead of you, 10 months ahead of you to put something down. And also health insurance. At least it can do something for you before the need arises to get a huge sum of money. So, and it's free for pregnant women. Health insurance is free for pregnant. It helps. Let's not listen to people that say health insurance will not do anything. For pregnancy, it takes care of everything. Unless complications and other drugs that is not in the scheme of the health insurance. But with that, even Scan they use for health insurance.
Yeah, but health insurance aim is to take part of it. Health insurance is relieving you of some stress. Yes, like the greater stress, but not taking everything. Yes.
Because I know with Scan at some facilities, with your health insurance, you take free scan.
Okay.
You take free scan. Yes.
Please, it's not everybody's facility.
It's not every so you don't go to private facility and expect free scan, no. But even some polyclinics I know, some of them subsidize and the health insurance also takes part, so it takes free scan there. So you also visit look out for the facilities to visit. Don't follow friends or follow other people. They are going to bigger hospitals, so you also want to go and deliver there. It comes with a cost.
Yeah.
So know your level, know what you have, get your health insurance, then go to the government facility or a facility closer that you think you can afford when it comes to any emergency, that you have to rush to the theater or buy certain drugs or blood and other things to supplement. So please, planning is key in pregnancy, because in pregnancy, anything can happen at any time, from the scratch of the pregnancy to delivery, even after delivery.
Yeah.
Any emergency, any complication can set in at any time. Though we prevent it, but nature has its also cause to bring certain things up. And then we have to always, so we don't even need to get the funds at the end.
No.
From the scratch. So that is why you should plan before we get pregnant. And Mom's Health Talk Show have all these videos. If you've not had education on it, we've had our previous videos where we spoke at, we have 3 or 4 videos where we spoke about planning before getting pregnant. And then when you really plan well, do your labs with your husband, everything, you even know what you are going into. Because some their blood with their husband, they are not compatible. Some with the what do you call it? The one they have to give the anti-D.
Resource.
Yes, the resource factors are not compatible. They are not. So you know all this before you go into. So you know that at the end of the delivery, quickly you'll be taking anti-D. You get it there. So we don't wait for things to end. You said, oh, they didn't tell me. No. Because we also don't prepare ourselves and we don't plan. Auntie Midwife, thank you so much. So, Madam Tracy, it's time for, or I've seen the labor signs, and then I feel like, these home nurses, don't go to the hospital early. When you go, they will waste your time. They will be coming to do V in and out. This nurse will come and do V. This doctor will come and do V, examination, everything. So wait in the house. When you feel that the baby is in between your legs, then you rush to the hospital. When people delay with the labor signs, what happens? Does it result in any complications or what happens?
So then delay in the house. Mommy, we have always have deliveries at the car park.
Oh.
You come, they'll call you. I think there's one the straight facility I read that they'll call you that they are coming. Sometimes you deliver babies into your bare arms without gloves, because by the time you get there you are wearing gloves. Baby is already there. You don't take baby. You take baby. And some people also deliver in the car.
Most of the
before
time.
coming.
We hear it.
Yes. Some will deliver in the house. Then
so
come
it means that they delayed in the house.
Yes.
Okay.
They delayed. But there's another thing about being delayed and having the baby. And there's one thing that labor has delayed, but baby is not in. Labor has, you are feeling all the signs. The cervix is not dilating. Nothing is going on.
Okay.
That has its also its own complications.
Okay.
Like the obstructed labor, where the shoulder is closed, their baby's head gets stuck in the pelvic bone, and the shoulder is not turning to be able to come. And there's fetal distress.
Okay.
Baby will be in distress because baby's head has been in there for a long time, and baby is not coming.
Okay.
Yes, and there are some cervix will dilate to 10 cm. Wow. Then it has come to push it. But the maternal effort is not there. So when the maternal effort is not there, it has led to prolonged labor, because you can be standing in front of mother, push for more than 2 hours. Mother is not pushing.
So why is it? Because the person didn't eat, or
Yes,
They have shouted for a
yeah,
long
and
time.
sometimes due to exhaustion, sometimes it's not their fault. Baby's head is high. So baby's head descending is a problem. And sometimes baby is big.
Okay.
Yes. So this thing, that's why we have to go to the clinic and let us see, because the scan will make us know the weight of what we are getting in.
So you don't delay in the house because all these things must be
Yes,
assessed.
you don't delay.
Okay.
You don't. If you delay and you know that you have takashis in there, then delay and come and make sure baby is out. Sometimes you've delayed in the house, you've come, baby has come. Now another problem is postpartum hemorrhage.
Yeah.
Yes. Then now we are coming to sort out bleeding. Sometimes baby has come in the car, right? Placenta is not coming. You have to do manual removal. You see, sometimes you may think you are giving yourself time, which sometimes is good, but don't let it go overboard.
Okay. Because we are not the midwife. So
Yeah, we don't do it every hour. VE is painful. Even we midwives, we know. We don't. How do you think that a midwife come and stand before them? She's happy that she's doing UVE. It's painful, but we have to do it. And sometimes it aids also in dilating this, because the midwife going in there sometimes try to stretch and go, and it's every 4 hours. It's not every hour. So you rest within that 4 hours. We beg you. So come to the hospital when you see her. Yes, because there are lots of complications. Sometimes you have fresh stillbirth. Labor has delayed, sir. You delayed in the house. Now you delay in the house and you think you are having contractions. Meanwhile, fetal heart rate is not there. But you don't know. But if you were in the hospital, maybe labor is delaying in the hospital. We are monitoring the heart rate. You know that fetal heart rate is not good. So what are we doing to prevent this fresh stillbirth?
Okay.
Yes.
Wow.
Then there can be meconium aspiration. Baby can poo in the water, and the sac that is in. Then baby will aspirate this fluid into his lungs. Then you are in the house, then you not know. Meanwhile, if you are in the hospital, when baby has meconium aspiration, sometimes it causes distress. So you see that the heart rate will be fluctuating. Okay. That's when we see that there's something going wrong. Then we try and do when you do vagina, you see that there's meconium stage. So that's when we know that this is what we have to do. But you be in the house, you come.
Okay, so that's when they do V, then they will be checking.
Yeah, you have to see what
the
like the color
and everything. Oh, okay.
Because on our pathograph, we have a place that will state that if the liquor is clear, if it's bloody or it's meconium stained.
Okay.
So V is important. V sees a lot of things, but it's painful. But we beg you, bear with us. It's painful,
it's just
bear
for
with us. We beg you.
Okay. So now we have to go to the hospital early with the signs. What should the mother do or the pregnant woman do before going to the hospital when they see the signs? How should they prepare themselves? Because I remember with my first pregnancy, I was going to the hospital. I was with my jeans, and the doctor then they asked me, "Are you ready to? Are you sure you are coming to deliver with jeans on?" I said yes. He said no. They have to remove everything. So how should we prepare ourselves when we see this?
Firstly, you are coming. Let's say your water broke in the house, and maybe you can, if you have the time to pour water on, you just pour some small water. Dress appropriately, wear some nice dress. Then put pad. Because maybe the car is not your car. Even if it's your car, you stay in your car.
Okay.
Put on pad so that the pad will be to hold the fluids that is coming.
Okay.
Yes. Every day as a pregnant woman, the moment you get to 35, 34, let your bag be packed. It's not that your water has been. That's why you're not come to take cost sheet here, diaper here. Make sure your bag is packed. If your husband has a car, please tell him the car now is for his child. Put the bag inside so that anytime they are taking you, the bag is already there. All your when you come, you have to bring your scans, your labs you've done. It's very, very important. So that when we take it, we'll see what you've done.
With your antenatal.
Yes, your book is one. If you don't go to in labor without your book, please, how do you expect us to take care of you?
Okay.
Yes.
So without a book, you can't do anything.
Yes, and if it's your facility, they can do something. But if it's not a facility that you've not gone to, sometimes you come here in labor, maybe you are not at a stage I have to do vaginal examination. Maybe at 34 we do speculum examination. I don't know. Then I'll come and put my hand in there It's bad. So please always make sure your book is available, your bag is packed. When you are going, please smell nice. We beg you. Also make sure to that if you get when you are getting to detergents, if you can't shave, let your husband help you shave. Shave. Make sure we don't want quatrekwa. You can't do quatrekwa, but make sure that place is shaved. Okay. Do unto others what you want others to do unto you. Okay. Shave it fine. When you come, we will shave it for you. But you nah, I'm shaving. You like it, so shave it. Make sure that place looks clean. Everything is packed. When you come to Nyabotre, we know you are in pain, you are confused, but also know that the midwife is human. If you come in, we are telling you they are shouting at the midwife. She that she come to you, shouting at her, but just that we've taken an oath, so we can't do it. We have to give you our care and everything, but just that consider the midwives too, they are humans.
So for them to do the right, have the right frame of mind. Yes.
And you have to keep the times of everything that happened. When you come in, your water have already booked. We ask you the time and that the water books. You have to keep those things in your head.
So from the onset of the signs, yes, you have to
then
keep time.
We ask you, Abia, you come, I'm feeling pain. What time did you start feeling the pain? So everything that will happen to you now, always take notes, because when you come in, we ask you so that you give us a better description of what has transpired, so that we know where we are taking it from.
Oh, it's sad that I want to end it here, but our time is up. We are not ending the labor signs here, because we have to go into the labor itself. Now we've seen the signs, what to do before you even get to the hospital, what we are expecting, how the pain feels like, how it looks like, the bloody show, how it looks like, how it comes, the quantity of it, so that I know that this is the bloody show, the nausea and the vomiting, and the essence of having all these signs, which aids in labor. We'll come to the labor itself next week on the next episode. So today, this is where we draw the curtains. Thank you for sitting with us on Mom's Heart Talk Show, where we bring you all the gist on pregnancy, all the gist on labor, all the gist of maternal health. We are doing all these things to reduce maternal mortality. We don't want our mothers to go to the facility and die, and then their babies will die. The excitement of getting pregnant, and then the expectation of getting your baby, that when the baby is welcome in the home, the happiness with which it brings to the home. This is why we are doing this. We don't want a situation where people will now have panic of even getting pregnant, because we know that when you get pregnant, the probability of death is higher than survival. No, we don't want it like that. We want it that our midwives are ready, our doctors are ready, our facilities are well resourced, and then we are also ready with our plan to have our baby. When you plan your baby, everything goes on smoothly. So let's plan our pregnancy. Let's prepare for labor, and then let's anticipate these complications, and then when you are in that right environment with the right people, the midwives around you, everything will be sorted out. And then remember also to pray that our Father who puts this baby in our womb also do his best to take care of us, and then we'll all have a happy end with our pregnancy. Follow us on all our social media handles on Mom's Heart Talk Show, YouTube, Facebook. If you missed it on live, you can go back and watch the videos later. And then our website, www.momsheartfoundation.org. We have our mother care products on our website. You can order for anyone that you want. We'll deliver it at your doorsteps. And then the money that comes out of it, we use that same money to support our mothers who are in need. There are some mothers at the facility who has already given birth, and they don't have the money to even be paid for them to be discharged. And their babies, when they are out there, they are exposed to these infections in the hospital, and it even ends up in death. So we want you to support us as we also support the society, especially with the vulnerable groups, so that we can all reduce maternal mortality. My name is Sheila Jukum, your host for Moms Heart Voice. See you in our next episode.